you and I have both seen quite a bit as cold exposure has come on the scene and had this meteoric rise, that there are practitioners out there that are just blanketing and getting on to social saying, do not get in cold. This is not good, especially for females, right? And that's a big focus of this show, is also around, female health, but just in general for people across the board to say, hey, getting in cold is not a great idea, period. And so that's where some of this conversation, of course, where I came to you right away and we spoke at the retreat to say, hey, can you talk on this topic? It was bubbling up so much that the things you planned to talk about at the retreat were like, can we talk about this instead? Because you bring this wealth of knowledge. So for all the listeners out there, this is what Carrie's specifically speaking to, is the nuance that exists within that structure and how we can understand the variables of utilizing cold in the world of Chinese medicine, and how there's a possibility and there's space for all.
Yeah. So I want to go back specifically with women, and one of the big ones that's come up on social media a lot is cold in the womb, right? So like I said, cold can enter the body. If you think of a contained space and all of a sudden you empty it out, it's now a space where something can go. So I've seen a lot of practitioners, and you've actually come to me to help handle the conversations where they're talking about not wanting women to go into cold because of the potential of cold entering the womb. And this is something that we spoke about at the level 2, that I was actually one of those individuals who had cold in my womb. I went swimming in a freezing cold lake on my 3rd menstrual cycle, and then ended up with a cascade of the next 15, 17 years of my life dealing with dysmenorrhea, delayed cycles, clotting, stabbing pain. And then I'm in class in one of our fundamentals classes where we learn all of the theory of Chinese medicine. And it very eloquently and in artistic language talks about cold entering the womb when the womb is made vacuous, meaning we've gone through our menstrual shed, we're bleeding, we're creating a vacuum, there's space for it to go, and swimming in a cold lake, the cold entering the womb. And I'm sitting there and I went, oh my gosh, that's me. I have 35-day cycles instead of 28-day cycles. I started passing large clots when I was 13 years old. I had sharp stabbing pains that almost sent me to the hospital 6 months into having menstrual cycles. And it wasn't until I was treated with herbs that break up stasis, so break up the blood clotting in the womb, acupuncture to regulate the cycle, and